A 16-year-old girl comes to the physician because of mole on her face. She said she would like to get removed. The patient recently moved to new school and has been bullied because of the mole multiple times. She is afraid she might rip it off when she washes her face or puts makeup on. She has no personal or family history of serious illness. She does not smoke cigarettes, drink alcohol, or use illicit drugs. She lives with her parents and grandmother. The vital signs are within normal limits. Physical examination shows 5 mm brown papules above the right eyebrow, consistent with melanocytic nevus. The physician explained this type of skin condition is generally benign and risk of malignancy transformation is low. Patient says that she is aware of potential risk of procedures and she would like to proceed with excision. Which of the following is appropriate response from the physician? So what should we do in this patient who is asking to get rid of the mole and is a minor and is not anticipated minor, is unanticipated minor. That's what we call. No way, we should not perform any kind of surgery. So the correct answer here is A. We cannot perform any kind of surgery or any kind of procedure until the parents consent. Okay. We cannot ask them to come back at 18. The ethics community should not be involved in this because it's a straightforward minor asking to do surgical procedure to look a plastic surgery or something procedure to have the moles removed. I cannot perform with you should not say the malignant transformation. You should try to have a very good vocabulary that patient can understand rather than getting malignant transportation. We should use very easy vocabulary to make patient understand. You cannot do the procedures until the parents consent it to. If she is pregnant and asking for term in certain states of United States, still there is an still abortion is legal in certain states, but in certain states there is the provider should not give any kind of abortion to this. So this is a very interesting topic. We should not give any kind of termination, or if the patient is pregnant, should we terminate? In USMLE, you can refer it to the physician who, or you can, if you are okay with doing the abortion, you should proceed with it. But during in certain states, it's very illegal to do. Like Oklahoma, they recently passed very strict laws, so that's why the OB-GYNs of that states are protesting against them. Like there is a Oklahoma, that is a state which with very high uh, abortions, so they passed a law for illegal abortion. So we have to look out, and they usually will say the physician does not perform, so we can recommend them to another physician who can perform a medical or surgical abortion. So in this patient is doing some cosmetic procedure should not be performed until parents consent to it. Okay. So whenever this kind of adolescents come for routine screening, what should we do for the routine screening? First of all, the mental health, or we can do depressions questionnaire, which is very important in this age group. Like let's say age group from 12 to 18 in United States, they have high risk of having depression. So mental health screening should be done, and if the patient is having any kind of any signs of depression, they should be informed to the parents, because there is an increased risk of suicide in the patient. So depression screening should be done. Sexual health screening should be done. The confidential discussion between sexual activity can be performed, and gonorrhea or chlamydia testing if the patient is sexually active, and HIV testing once at the age less than 18. Which, as there is a risk of substance use in the adolescents in United States, so we have to perform an drug confidential discussion about exposure, use, and abuse, and also the risk factor of the different substance use and medical conditions. Dyslipidemia, the lipid panels should be checked once between the age of 17 and 21. Safety should be given to this patient adolescents. You should inquire about the bullying. is is as this patient had been bullying for the quite a while, so we have to inquire the bullying and inform the parents. Inquiry about seat belt and helmet use should be given to this patient. Okay, so here it says a certain a minor is a person who is under the age of 18. With some exception, minor generally is not considered competent to make general decisions, because they make stupid decisions. So we do not give any decision making authority in cosmetic type of procedures. While in rock and roll procedures, like let's say procedures related to sexually transmitted diseases or certain kind of substance use, we can still go ahead and treat them. Only parents and legal guardians can give consent for the minors. Neighbors, aunts, uncle, grandparents cannot. Remember, neighbors, aunt, uncle, grandparents cannot give the consent for the treatment. This rule does not cover the life-threatening or serious emergency. Whenever there is serious emergency, consent is always implied in emergency treatment in minors. A physician should not withhold the blood or surgery for life-threatening incident just because parents do not. So remember, this is very usual question USMLE asks. Certain religious group, they refrain or they do not take blood products from another individual. So it's called Jehovah's Witness. So this religious group does not take any kind of blood products from the any patient. So let's say a mother and a child was going to the school and they had an accident and both required blood transfusion. So what should we do? And we call the father, and father said do not provide blood to any one of them because they are belongs to Jehovah's Witness. So what should we do? We should go ahead and proceed to transfuse the child and should not transfuse the mother, because you can see the here in the physician should not withhold a blood or surgery in life-threatening incidents. Okay, minors have medical decision making power only in certain medical situation that allows for confidentiality, like contraceptive cares or in legal scenario for grant anticipation. In certain other circumstance, in this case is parents or guardian is responsible for providing the consent.
Thanks for watching. Please give a thumbs up and subscribe for more.